institution realized probably 3 to 5 years before the rest of the country that there was a brewing opiate crisis. And we actually published some of the work from Community Hospital in the kind of late 2000s, early 2010s, and really kind of signaled some of the early research that this was a developing problem. And so it was a natural next step when we said, we need to effect a change. The institution was already ready to make that change. A number of different organizations, fire departments, drug treatment programs, police departments, the Monterey Bay Dental Society, we needed to create a coalition to take on addiction, specifically to opiates in Monterey County. And it's grown from that first year to now we have a coalition of, I think, over 35 organizations that are committed in Monterey County to trying to treat addiction, prevent overdoses, allow for safe pain management, and provide good education to the community. When we put all these great Montage minds together, let's see what we can develop. And then again, when we asked for help from the foundation, they said no problem. And then it's been so exciting to be able to publish the results in the National Library of Medicine. We are one of 7 hospitals in the country that have achieved this designation as a pain and addiction certified emergency department. And what's even more worth bragging about is we're one of only 3 in the country that are at the gold level. The first hospital to achieve it is the hospital that wrote the program. The second was Harvard, and the third is Community Hospital of the Monterey Peninsula.
Welcome to the Pediatric Wellness Program.
Bienvenidos al programa de bienestar.
The Pediatric Wellness Program is part of the Diabetes Collaborative, and our goal is really to reduce the incidence of diabetes in Monterey County. And one of the most important ways to do that is working with our youth, working with kids. But our program really centers around the whole family, getting everybody involved. Community is a huge driver. Support is a huge driver of success.
The way that we like to think about our programs and services is we are meeting individuals and families where they are at. We make it fun, we make it engaging. We're not just telling them what to do, but helping them when they go home, again, establish these lifelong habits that they can do together as a family. So with donor support, we will be able to continue to expand our reach and our impact in the community, but not only continue our classes, but expanding the classes through curriculum, through resources, by working with other stakeholders. And so again, additional support would be able to create that meaningful impact and expand our reach.
During these classes, we really try to educate the families on how they can improve their lifestyle. We focus on nutrition, physical activity, screen time, and sugary drinks. We try to encourage behavior change by setting these goals, and we try to really motivate them and push them to just try new things when it comes to their lifestyle.
Lo que me gustó mucho el ejercicio, me gustó porque ya estando en grupo se motivan los niños y también nosotros.
I tell the folks within the Montage Health system that we grant to do not think of us as a bank. Think of us as a venture capital firm. We're literally here to help them grow, innovate, try and fail and learn from those failings, to pilot, to be a resource for them so that they can do the things that a normal operating budget in the middle of patient care and in the middle of the day-to-day things, they don't have the bandwidth to do. So the more that we have available to us is the more that we can help them innovate and stay at the tip of the spear.
I've always felt that unrestricted giving is almost twice as valuable to any institution as restricted giving. And we have a lot of confidence in the people who run this organization. And I guess our feeling is that they know a heck of a lot more about where the money needs to go than we do.
What I love about working in an innovative environment is that our partners in this, meaning the clinicians, the healthcare providers, the administrators and leaders and whatnot, are so good at what they do that when we step in and provide our technical assistance and expertise and financial support and whatnot, it becomes an exponential synergy. It really helps that I'm surrounded by a whole institution of people that know how to build buildings, know how to build programs, know what patient care really needs to be. All that stuff's already there.
It's no secret that the hospital is well supported by the foundation. As a physician, you can just go to work. We are proud to be able to work at this institution where we are given the support to be able to excel and innovate.